Hi everyone, this is Nurse Hannah from nursestudy.net. I've lost my voice again, so I'll make this quick. We have sepsis, 50 questions with answers and rationales. Enjoy. And if you would like one of our free audio books with NCLEX questions on ACX or Audible, the links are in the description below. Enjoy the questions.
Question 1. A 65-year-old male presents to the emergency department with suspected sepsis. His vital signs are temperature 39.2 degrees Celsius, heart rate 122, blood pressure 82/48, respiration rate 24. The nurse anticipates which healthcare provider orders should be implemented first. A. Obtain blood cultures and begin broad-spectrum antibiotics. B. Start norepinephrine infusion. C. Begin 30 milliliters per kilogram crystalloid bolus. D. Insert a central venous catheter. Correct answer, C. Rationale: in sepsis management, the first priority is fluid resuscitation with 30 milliliters per kilogram of crystalloid within the first 3 hours. While blood cultures and antibiotics are crucial, option A, they follow initial fluid resuscitation. Norepinephrine, option B, is indicated if hypotension persists after fluid resuscitation. Central line placement, option D, may be necessary, but isn't the first priority. Question 2. During a sepsis code, the nurse is caring for a patient who has received 2 liters of normal saline. The patient's MAP remains at 58 millimeters of mercury. Which finding would indicate the need for immediate vasopressor therapy? A. Serum lactate of 2.1 millimoles per liter. B. Urine output of 30 milliliters per hour. C. Central venous pressure of 12 millimeters of mercury. D. SCVO2 of 65%. Correct answer, A. Rationale: according to sepsis guidelines, vasopressors should be initiated when mean arterial pressure, MAP, remains less than 65 millimeters of mercury despite adequate fluid resuscitation. The elevated lactate, greater than 2 millimoles per liter, with persistent hypotension indicates tissue hypoperfusion requiring immediate vasopressor support. The other values, options B, C, and D, are within acceptable ranges and wouldn't independently trigger vasopressor initiation. Question 3. A nurse is assessing a patient with gram-negative sepsis who has been receiving norepinephrine for 12 hours. Which finding requires immediate notification of the healthcare provider? A. Mottled skin appearance on extremities. B. Peripheral capillary refill of 3 seconds. C. Diminished pedal pulses bilaterally. D. Cool temperature of fingers and toes. Correct answer, A. Rationale: mottled skin appearance, particularly in a patient receiving vasopressors, indicates severe tissue hypoperfusion and potential progression of shock requiring immediate intervention. Mottling suggests microvascular dysfunction and can be an early warning sign of deteriorating tissue perfusion, even when macrohemodynamic parameters appear stable. Other findings such as peripheral capillary refill of 3 seconds, B. Diminished pedal pulses, C. And cool extremities. D. Can be expected findings in patients receiving vasopressors due to alpha-adrenergic peripheral vasoconstriction. However, mottling specifically suggests inadequate tissue oxygenation at the microvascular level and has been associated with increased mortality in septic shock. Question 4. A nurse is caring for a patient with sepsis who has developed acute kidney injury. The patient's latest lab values show BUN 45 mg per deciliter, creatinine 2.8 mg per deciliter, potassium 6.2 milliequivalent per liter, pH 7.28. Which early sign should the nurse monitor that could indicate worsening hyperkalemia? A. Changes in level of consciousness. B. Altered T waves on cardiac monitor. C. Decreased respiratory rate. D. Bilateral pedal edema. Correct answer, B. Rationale: early signs of hyperkalemia are best detected on ECG monitoring, with tall, peaked T waves being one of the earliest indicators. This occurs before the more serious complications like QRS widening or cardiac arrest. Changes in consciousness, A, are late signs. Respiratory changes, C, are not typically associated with hyperkalemia, and edema, D, is unrelated to hyperkalemia. Question 5. A patient with septic shock has been receiving norepinephrine at 12 micrograms per minute for 4 hours. Despite this intervention, their MAP remains at 58 millimeters of mercury. Which additional medication should the nurse anticipate being ordered? A. Dopamine. B. Vasopressin. C. Phenylephrine. D. Epinephrine. Correct answer, B. Rationale: vasopressin is typically added as a second-line vasopressor when norepinephrine alone fails to achieve target MAP greater than or equal to 65 millimeters of mercury. Unlike other options, vasopressin works through a different mechanism, V1 receptors, and can help reduce norepinephrine requirements. Dopamine, A, is no longer recommended as first-line therapy. Phenylephrine, C, is generally reserved for specific situations, and epinephrine, D, is typically used as an alternative to norepinephrine, not as an addition. Question 6. A nurse is performing a sepsis screening on a patient with suspected pneumonia. Which combination of findings would meet the criteria for sepsis according to the QSOFA score? A. Temperature 38.5 degrees Celsius, WBC 15,000, heart rate 98. B. Respirations of 24, altered mentation, blood pressure of 100/60. C. Lactate 1.8 millimoles per liter, platelets 140,000, heart rate 110. D. Creatinine 1.8 milligrams per deciliter, bilirubin 2.0 milligrams per deciliter, temperature 38.2 degrees Celsius. Correct answer, B. Rationale: the QSOFA score includes 3 criteria: respiratory rate greater than or equal to 22 per minute, altered mental status, and systolic blood pressure less than or equal to 100 millimeters of mercury. Option B is the only combination that includes 2 QSOFA criteria: elevated respiratory rate and altered mentation. The other options include various abnormal findings, but don't meet specific QSOFA criteria. Question 7. A nurse is caring for a patient with septic shock who has been receiving broad-spectrum antibiotics for 48 hours. The patient's blood pressure has normalized, but their temperature remains elevated at 38.9 degrees Celsius. Which assessment finding would be most concerning? A. New onset of productive cough. B. Persistent tachycardia. C. Decreased oxygen requirements. D. Improved mental status. Correct answer, A. Rationale: a new onset of productive cough after 48 hours of appropriate antibiotic therapy could indicate a secondary infection or antibiotic resistance, requiring immediate medical attention. Persistent tachycardia, B, can be expected during recovery, while decreased oxygen requirements, C, and improved mental status, D, are positive signs of improvement. Question 8. A nurse is caring for 4 patients. Which patient should the nurse assess first based on the highest risk for developing sepsis? A. 45-year-old with type 2 diabetes and a small foot ulcer. B. 72-year-old receiving chemotherapy with a portacath. C. 35-year-old post-appendectomy day 2 with mild incisional pain. D. 60-year-old with COPD using home oxygen. Correct answer, B. Rationale: the 72-year-old chemotherapy patient with a central line is at highest risk for sepsis due to multiple risk factors: advanced age, immunosuppression from chemotherapy, and presence of an invasive device. While the other patients have risk factors, diabetes, surgery, chronic illness, the combination of factors in option B creates the highest risk scenario. Question 9. A nurse is implementing sepsis bundle interventions for a newly admitted patient. Which intervention should the nurse question if ordered within the first hour of presentation? A. Administration of cefepime 2 grams IV. B. Placement of an arterial line. C. Collection of blood cultures. D. Fluid challenge with 30 milliliters per kilogram NS. Correct answer, B. Rationale: while arterial line placement may be necessary for ongoing management of septic shock, it should not delay the implementation of time-sensitive bundle elements in the first hour: fluid resuscitation, blood cultures, antibiotics. The other interventions, A, C, D, are all appropriate and time-critical components of the initial sepsis bundle. Question 10. A nurse is caring for a patient in septic shock who has received appropriate fluid resuscitation and vasopressors. The patient's arterial blood gas shows pH 7.28, PaCO2 32 mm of mercury, HCO3 15 milliequivalent per liter, PaO2 88 mm of mercury. Which compensatory mechanism is primarily demonstrated? A. Respiratory alkalosis. B. Metabolic acidosis with respiratory compensation. C. Respiratory acidosis with metabolic compensation. D. Mixed metabolic and respiratory acidosis. Correct answer, B. Rationale: the blood gas values show a primary metabolic acidosis low HCO3 with respiratory compensation low PaCO2. This is a common finding in septic shock due to lactic acidosis from tissue hypoperfusion. The body compensates by increasing ventilation to lower PaCO2. The other options do not correctly interpret the relationship between the primary disorder and compensatory mechanism. Question 11. A nurse is caring for a patient with septic shock who develops acute respiratory distress syndrome, ARDS. The healthcare provider has ordered prone positioning. Which finding would contraindicate this intervention? A. BMI of 40. B. Presence of bilateral chest tubes. C. Recent abdominal surgery with open wound. D. Continuous renal replacement therapy. Correct answer, C. Rationale: an open abdominal wound from recent surgery is an absolute contraindication to prone positioning. While obesity, A, chest tubes, B, and CRRT, D, make prone positioning more challenging, they are not absolute contraindications when proper precautions are taken. Question 12. A nurse is monitoring a patient with sepsis who has developed disseminated intravascular coagulation, DIC. Which combination of laboratory values would most strongly indicate worsening DIC? A. PT 15 seconds, fibrinogen 200 mg per deciliter, D-dimer 1000 nanograms per milliliter. B. PT 18 seconds, platelets 80,000, fibrinogen 400 mg per deciliter. C. Platelets 50,000, fibrinogen 100 mg per deciliter, D-dimer 4000 nanograms per milliliter. D. D-dimer 2000 nanograms per milliliter, platelets 100,000, PT 14 seconds. Correct answer, C. Rationale: the combination in option C shows the most concerning pattern for worsening DIC, significant thrombocytopenia, low fibrinogen consumption, and markedly elevated D-dimer. This pattern indicates both increased coagulation and consumption of clotting factors. The other options show less severe or incomplete patterns of coagulation disturbance. Question 13. A nurse is caring for a patient with septic shock who has developed acute kidney injury. The patient's urine output has been less than 0.3 milliliters per kilogram per hour for the past 8 hours, despite fluid resuscitation. Which assessment finding requires immediate healthcare provider notification? A. Respiratory rate of 24 breaths per minute. B. Serum potassium of 6.8 milliequivalent per liter. C. Blood glucose of 180 mg per deciliter. D. Creatinine increase from 1.8 to 2.2 mg per deciliter. Correct answer, B. Rationale: a serum potassium level of 6.8 milliequivalent per liter represents severe hyperkalemia that requires immediate intervention due to the risk of cardiac arrhythmias. While the other findings are abnormal, they don't represent immediate life-threatening conditions requiring emergency intervention. Question 14. A nurse is reviewing the medication list for a patient with sepsis secondary to pneumonia. Which combination of medications requires closest monitoring for potential adverse interaction? A. Vancomycin and norepinephrine. B. Piperacillin-tazobactam and furosemide. C. Vancomycin and piperacillin-tazobactam. D. Norepinephrine and methylprednisolone. Correct answer, C. Rationale: The combination of vancomycin and piperacillin tazobactam has been associated with an increased risk of acute kidney injury compared to either agent alone. This combination requires careful monitoring of renal function and drug levels. The other combinations, while requiring normal monitoring, don't have this specific documented interaction risk. Question 15. A patient with septic shock has been receiving norepinephrine for 24 hours. The nurse notes progressive darkening of the fingers and toes bilaterally. Which intervention should the nurse anticipate? A. Discontinuation of norepinephrine. B. Addition of dobutamine. C. Switch to phenylephrine. D. Initiation of vasopressin to reduce norepinephrine requirements. Correct answer, D. Rationale: adding vasopressin can help reduce norepinephrine requirements while maintaining adequate perfusion, potentially reducing peripheral ischemia. Simply discontinuing norepinephrine, A, could cause hemodynamic collapse, dobutamine, B, wouldn't address the peripheral ischemia, and switching to phenylephrine, C, wouldn't improve the situation as it's also a pure vasoconstrictor. Question 16. A nurse is caring for a neutropenic patient who develops sepsis. Which finding should prompt the most immediate intervention? A. Temperature of 38.3 degrees Celsius. B. Single blood pressure reading of 100 over 60 millimeters of mercury. C. Heart rate increase from 88 to 100 beats per minute. D. New onset rigors with temperature 37.8 degrees Celsius. Correct answer, D. Rationale: in neutropenic patients, rigors, even with a relatively normal temperature, indicate serious infection requiring immediate intervention. Neutropenic patients may not mount the same inflammatory response as non-neutropenic patients, making any sign of infection more significant. While the other options show changes, they are less concerning in isolation. Question 17. A nurse is implementing a sepsis protocol for a patient with severe sepsis. Initial labs show pH 7.15, lactate 6.5 millimoles per liter, SCVO2 55%. After fluid resuscitation and norepinephrine initiation, which parameter best indicates adequate oxygen delivery? A. Central venous pressure. B. Mixed venous oxygen saturation. C. Mean arterial pressure. D. Arterial blood gases. Correct answer, B. Rationale: mixed venous oxygen saturation, SVO2, or central venous oxygen saturation, SCVO2, is the best indicator of the balance between oxygen delivery and consumption. While all parameters provide valuable information, SCVO2 and SVO2 specifically reflects tissue-level oxygen utilization and adequacy of cardiac output. Normal SCVO2, greater than 70%, indicates adequate oxygen delivery relative to consumption. Question 18. A nurse is assessing a patient with septic shock who develops acute liver dysfunction. Which combination of findings indicates hepatorenal syndrome? A. AST 450, ALT 380, creatinine 1.5 mg per deciliter. B. Total bilirubin 3.5 mg per deciliter, BUN 45 mg per deciliter, creatinine 1.8 mg per deciliter. C. Creatinine 2.5 mg per deciliter, oliguria, normal renal ultrasound. D. Direct bilirubin 2.0 mg per deciliter, proteinuria, hypertension. Correct answer, C. Rationale: hepatorenal syndrome is characterized by acute kidney injury, elevated creatinine, oliguria, in the setting of liver dysfunction, with normal renal ultrasound findings, indicating no structural kidney disease. The other options show various abnormalities but don't specifically indicate hepatorenal syndrome. Question 19. A nurse is caring for a septic patient who requires mechanical ventilation. The patient's PaO2 and FiO2 ratio is 150, and they're receiving lung-protective ventilation. Which parameter should the nurse monitor most closely? A. End-tidal CO2. B. Plateau pressure. C. Auto-PEEP. D. Respiratory rate. Correct answer, B. Rationale: in patients with ARDS secondary to sepsis, plateau pressure must be kept less than or equal to 30 to prevent ventilator-induced lung injury. While all parameters are important, plateau pressure is the most critical for preventing further lung injury in the setting of protective ventilation. Question 20. A nurse is preparing to administer a vasopressor to a septic patient through a peripheral IV. Which intervention is most important to prevent complications? A. Use the largest available peripheral catheter. B. Rotate the IV site every 12 hours. C. Monitor for infiltration every hour. D. Place the IV in the antecubital fossa. Correct answer, C. Rationale: when vasopressors must be administered peripherally, frequent monitoring for infiltration, at least hourly, is crucial to prevent tissue necrosis. While catheter size, A, and site rotation, B, are important, hourly monitoring is most critical. The antecubital fossa, D, is not an ideal site due to the risk of complications if infiltration occurs. Question 21. A pregnant patient at 32 weeks gestation presents with sepsis due to pyelonephritis. Which finding would be considered normal for this patient but concerning in a non-pregnant patient? A. Heart rate of 110 beats per minute. B. Respiratory rate of 24 breaths per minute. C. White blood cell count of 14,000. D. Blood pressure of 90/60 mm of mercury. Correct answer, C. Rationale: a WBC count of 14,000 is normal during pregnancy due to physiologic leukocytosis, but would be concerning in non-pregnant patients. The other vital sign changes, A, B, D, would be equally concerning in pregnant and non-pregnant patients with sepsis. Question 22. A nurse is caring for a pediatric patient with septic shock who has received 60 milliliters per kilogram of fluid resuscitation but remains hypotensive. Which finding indicates the need for immediate initiation of vasopressor support? A. Capillary refill time of 4 seconds. B. Heart rate of 165 beats per minute. C. Cold extremities with weak pulses. D. Altered mental status with decreased responsiveness. Correct answer, D. Rationale: altered mental status with decreased responsiveness in a fluid-refractory pediatric septic shock patient indicates severe end organ dysfunction requiring immediate vasopressor support. While the other signs, A, B, C, are concerning, altered mental status represents the most severe indication of inadequate tissue perfusion. Question 23. A nurse is monitoring a septic patient receiving empiric antibiotics. The microbiology lab reports gram-positive cocci in clusters from blood cultures. Which change in antibiotic therapy should the nurse anticipate? A. Addition of ceftriaxone. B. Initiation of vancomycin. C. Discontinuation of piperacillin-tazobactam. D. Addition of metronidazole. Correct answer, B. Rationale: gram-positive cocci in clusters typically suggest Staphylococcus species, which requires coverage with vancomycin until susceptibilities are known, particularly given the prevalence of methicillin-resistant strains. The other options don't provide appropriate coverage for this likely pathogen. Question 24. An immunocompromised patient with sepsis develops acute adrenal insufficiency. Which combination of findings would most strongly indicate this complication? A. Hyponatremia, hyperkalemia, hypotension refractory to fluids. B. Hypernatremia, hypokalemia, tachycardia. C. Hypoglycemia, metabolic acidosis, hypertension. D. Hyperglycemia, respiratory alkalosis, normal blood pressure. Correct answer, A. Rationale: the classic triad of adrenal insufficiency includes hyponatremia, hyperkalemia, and hypotension that is refractory to fluid resuscitation. This is particularly concerning in immunocompromised patients who may have been on chronic steroids. The other combinations don't represent typical adrenal insufficiency patterns. Question 25. A nurse is caring for a septic patient who develops delirium. Which intervention should be implemented first? A. Apply physical restraints. B. Administer scheduled antipsychotics. C. Implement environmental modifications. D. Request a psychiatric consultation. Correct answer, C. Rationale: environmental modifications, maintaining day-night cycles, minimizing interruptions, promoting orientation, should be the first intervention for sepsis-associated delirium. Physical restraints, A, may worsen delirium, antipsychotics, B, should not be the first-line treatment, and psychiatric consultation, D, is not the initial step. Question 26. A nurse is caring for an elderly patient with sepsis who develops acute encephalopathy. Which intervention would be most appropriate to assess the patient's cognitive status? A. Montreal Cognitive Assessment, MOCA. B. Confusion Assessment Method for ICU, CAM-ICU. C. Mini Mental State Examination, MMSE. D. Glasgow Coma Scale, GCS. Correct answer, B. Rationale: the CAM-ICU is specifically designed and validated for assessing delirium in critically ill patients, including those with sepsis. While other tools, A, C, D, can assess cognitive function or consciousness, they are either too complex for critically ill patients or don't specifically assess delirium in the ICU setting. Question 27. A nurse is monitoring coagulation parameters in a septic patient. Which combination of findings most strongly suggests compensated DIC? A. Platelets 90,000, PT 16 seconds, fibrinogen 400 mg per deciliter. B. D-dimer 2,500 nanograms per milliliter, platelets 140,000, normal PT. C. Fibrinogen 150 mg per deciliter, D-dimer 3,000 nanograms per milliliter, platelets 120,000. DPT 14 seconds, platelets 80,000, D-dimer normal. Correct answer, C. Rationale: compensated DIC typically shows moderate changes in multiple coagulation parameters, moderately low fibrinogen, elevated D-dimer, mild thrombocytopenia, without severe derangement of any single value. The other combinations either show isolated abnormalities or don't reflect the pattern typical of compensated DIC. Question 28. A postoperative patient develops sepsis 48 hours after abdominal surgery. Which finding should prompt immediate return to the operating room? A. New onset atrial fibrillation. B. Rising serum lactate despite antibiotics. C. Increasing vasopressor requirements. D. Rigid abdomen with severe pain. Correct answer, D. Rationale: a rigid abdomen with severe pain in a postoperative patient with sepsis suggests possible anastomotic leak or intra-abdominal catastrophe requiring immediate surgical exploration. While the other findings, A, B, C, are concerning, they don't specifically indicate the need for immediate surgical intervention. Question 29. A nurse is assessing tissue perfusion in a septic patient. Which parameter most accurately reflects microvascular perfusion? A. Central venous pressure. B. Mean arterial pressure. C. Sublingual microcirculation. D. Mixed venous oxygen saturation. Correct answer, C. Rationale: sublingual microcirculation assessment provides direct visualization of microvascular blood flow and is the most accurate reflection of tissue-level perfusion. The other parameters, A, B, D, are indirect measures of perfusion and may not accurately reflect microvascular function, particularly in sepsis where microcirculatory dysfunction can persist despite normal macrohemodynamic parameters. Question 30. A nurse is caring for a septic patient who develops acute cholestasis. Which medication requires immediate dosing adjustment? A. Norepinephrine. B. Vancomycin. C. Fentanyl. D. Cefepime. Correct answer, C. Rationale: fentanyl, being highly lipophilic and hepatically metabolized, requires immediate dose adjustment in cholestasis to prevent drug accumulation and oversedation. While other medications may need eventual adjustment, fentanyl's properties make it most susceptible to accumulation in acute liver dysfunction. Question 31. A nurse is monitoring a patient with septic shock who develops acute right ventricular dysfunction. Which combination of interventions should the nurse anticipate? A. Increase PEP, add dobutamine, maintain euvolemia. B. Decrease PEP, add epinephrine, minimize fluid administration. C. Maintain low PEP, add milrinone, ensure adequate preload. D. Increase PEP, add vasopressin, aggressive fluid resuscitation. Correct answer, C. Rationale: in right ventricular dysfunction, maintaining low PEP helps reduce RV afterload. Milrinone provides inotropic support with pulmonary vasodilation, and adequate preload is essential for RV function. The other combinations could worsen RV function through increased afterload, A, D, or inadequate preload, B. Question 32. A nurse is caring for a septic patient receiving mechanical ventilation. The patient's PaO2 and FiO2 ratio is 80, and they're requiring FiO2 1.0. Which advanced ventilation strategy should the nurse prepare to implement? A. High-frequency oscillatory ventilation. B. Airway pressure release ventilation. C. Prone positioning with neuromuscular blockade. D. Extracorporeal membrane oxygenation evaluation. Correct answer, C. Rationale: in right ventricular dysfunction, maintaining low PEP helps reduce RV afterload. Milrinone provides inotropic support with pulmonary vasodilation, and adequate preload is essential for RV function. The other combinations could worsen RV function through increased afterload, A, D, or inadequate preload, B. Question 32. A nurse is caring for a septic patient receiving mechanical ventilation. The patient's PaO2 and FiO2 ratio is 80, and they're requiring FiO2 1.0. Which advanced ventilation strategy should the nurse prepare to implement? A. High-frequency oscillatory ventilation. B. Airway pressure release ventilation. C. Prone positioning with neuromuscular blockade. D. Extracorporeal membrane oxygenation evaluation. Correct answer, D. Rationale: with severe hypoxemia, PF ratio less than 100, despite optimal conventional management and prone positioning, ECMO evaluation is indicated. The other options, A, B, C, are intermediate steps that should have already been attempted before considering ECMO in severe ARDS. Question 33. A 65-year-old male patient presents with fever, tachycardia, and confusion. Blood pressure is 85/50 mm of mercury, and lactate levels are elevated at 4 millimoles per liter. What is the nurse's priority intervention? A. Administer antipyretics for fever. B. Initiate 0.9% normal saline bolus. C. Obtain blood cultures before starting antibiotics. D. Monitor urine output hourly. Correct answer, C. Rationale: blood cultures should be obtained before administering antibiotics to identify the causative organism. While fluid resuscitation, option B, and monitoring urine output, option D, are critical steps, obtaining blood cultures is a priority to guide antibiotic therapy. Question 34. A patient in the ICU is diagnosed with sepsis secondary to pneumonia. The patient develops oliguria and anuria despite aggressive fluid resuscitation. Which complication of sepsis is the patient most likely experiencing? A. Disseminated intravascular coagulation, DIC. B. Acute kidney injury, AKI. C. Acute respiratory distress syndrome, ARDS. D. Multiple organ dysfunction syndrome, MODS. Correct answer, B. Rationale: oliguria and anuria indicate acute kidney injury, AKI, a common complication of sepsis caused by hypoperfusion and renal ischemia. ARDS, option C, typically presents with respiratory distress, and MODS, option D, is a more systemic progression. Question 35. The nurse is caring for a patient with sepsis who has a mean arterial pressure, MEP, of 55 mm of mercury after initial fluid resuscitation. Which medication does the nurse anticipate will be ordered? A. Vasopressin. B. Dopamine. C. Norepinephrine. D. Dobutamine. Correct answer, C. Rationale: norepinephrine is the first-line vasopressor used to increase MAP in patients with septic shock unresponsive to fluids. Vasopressin, option A, may be added later as an adjunct, while dopamine and dobutamine have specific indications. Question 36. Which lab result most strongly indicates the presence of sepsis in a patient? A. White blood cell count of 5,000. B. Procalcitonin level of 12 nanograms per milliliter. C. Serum lactate of 1 millimole per liter. D. Hemoglobin of 10. Correct answer, B. Rationale: a procalcitonin level greater than 2 nanograms per milliliter strongly suggests sepsis due to bacterial infection. Elevated serum lactate, greater than 2 millimoles per liter, would also support the diagnosis, but is not as specific. Question 37. A nurse is assessing a patient diagnosed with sepsis. The patient has warm, flushed skin, a temperature of 38.5 degrees Celsius 101.3 degrees Fahrenheit, and a heart rate of 115 beats per minute. What stage of sepsis does this most likely indicate? A. Early sepsis. B. Septic shock. C. Severe sepsis. D. MODS. Correct answer, A. Rationale: warm, flushed skin and elevated temperature with tachycardia indicate early sepsis. As sepsis progresses, patients may develop hypotension, organ dysfunction, and cold, clammy skin. Question 38. A 48-year-old female with a history of diabetes presents with a urinary tract infection, UTI. She reports chills, weakness, and abdominal pain. Vital signs: blood pressure 90/55 millimeters of mercury, heart rate 120 beats per minute, temp 39 degrees Celsius 102.2 degrees Fahrenheit. What is the most appropriate next step? A. Administer acetaminophen for fever. B. Initiate broad-spectrum antibiotics. C. Perform a urinalysis. D. Insert an indwelling catheter. Correct answer, B. Rationale: broad-spectrum antibiotics should be initiated promptly after cultures are obtained to treat the underlying infection causing sepsis. Fever management and urinalysis are supportive measures but are not the immediate priority. Question 39. The nurse is caring for a patient with sepsis, receiving IV antibiotics and fluid resuscitation. Which finding requires immediate intervention? A. Blood glucose of 150 mg per deciliter. B. Urine output of 20 milliliters per hour. C. Respiratory rate of 22 breaths per minute. D. Serum lactate of 2.5 millimoles per liter. Correct answer, B. Rationale: oliguria, less than 30 milliliters per hour, suggests inadequate perfusion and may indicate worsening organ dysfunction. Elevated respiratory rate and lactate require monitoring but are less immediately concerning. Question 40. A patient with sepsis develops petechiae and ecchymosis. Laboratory results show prolonged PT-INR and a decreased platelet count. Which complication should the nurse suspect? A. ARDS. B. DIC. C. MODS. D. AKI. Correct answer, B. Rationale: disseminated intravascular coagulation, DIC, is characterized by clotting abnormalities, including prolonged PT-INR and thrombocytopenia, leading to petechiae and ecchymosis. Question 41. A patient with sepsis has been receiving norepinephrine for 2 hours. The MAP is now 70 millimeters of mercury. What is the nurse's next priority? A. Discontinue norepinephrine. B. Reassess fluid balance and output. C. Increase the norepinephrine dose. D. Administer a corticosteroid. Correct answer, B. Rationale: once MAP stabilizes, the nurse should reassess the patient's fluid status and perfusion. Discontinuing norepinephrine or adjusting the dose without reassessment could destabilize the patient. Question 42. A nurse is educating a family about sepsis prevention. Which recommendation is most effective? A. Use over-the-counter antibiotics for minor infections. B. Delay vaccinations until after illness recovery. C. Perform regular hand hygiene. D. Limit fluid intake during fever. Correct answer, C. Rationale: hand hygiene is the most effective method for preventing infections that can lead to sepsis. Over-the-counter antibiotics are not appropriate, and delaying vaccinations may increase infection risk. Question 43. A patient with sepsis is receiving IV fluids. Despite adequate resuscitation, their blood pressure remains low, and they are started on norepinephrine. What parameter is most critical for the nurse to monitor during norepinephrine infusion? A. Heart rate. B. Peripheral perfusion. C. Blood pressure. D. Central venous pressure, CVP. Correct answer, C. Rationale: blood pressure is the most critical parameter to monitor during norepinephrine infusion to ensure adequate perfusion. Peripheral perfusion, option B, is also important but secondary to maintaining adequate blood pressure. Question 44. A patient with sepsis is exhibiting restlessness, agitation, and confusion. Which intervention should the nurse prioritize? A. Check arterial blood gases. B. Increase the oxygen flow rate. C. Administer a sedative. D. Assess for hypoxia or hypoperfusion. Correct answer, D. Rationale: restlessness, agitation, and confusion may indicate hypoxia or hypoperfusion. The nurse should assess and address these underlying causes before considering sedatives or increasing oxygen flow. Question 45. A 78-year-old female patient is admitted to the ICU with suspected sepsis. She has a history of diabetes and chronic obstructive pulmonary disease, COPD. Her current vitals are blood pressure 85/55 mm of mercury, pulse 125, respirations 28 per minute, and SpO2 89% on room air. Her lactate level is 5 millimoles per liter. What is the nurse's priority intervention? A. Administer 2 liters of oxygen via duct nasal cannula. B. Administer a 30 milliliters per kilogram bolus of 0.9% normal saline. C. Start norepinephrine infusion to stabilize blood pressure. D. Draw arterial blood gases, ABG. Correct answer, B. Rationale: fluid resuscitation with a 30 milliliters per kilogram bolus is the priority in a patient with septic shock to improve tissue perfusion. Oxygen supplementation, A, and drawing ABGs, D, are supportive measures but not the immediate priority. Norepinephrine, C, is considered if fluid resuscitation is insufficient. Question 46. A patient diagnosed with sepsis is started on broad-spectrum antibiotics after blood cultures were drawn. Despite this, the patient's blood pressure remains low at 90/60 mm of mercury, and urine output is 10 milliliters per hour. Which intervention should the nurse anticipate? A. Administer a loop diuretic to improve urine output. B. Begin vasopressor therapy with norepinephrine. C. Increase the infusion rate of maintenance IV fluids. D. Administer corticosteroids to address adrenal insufficiency. Correct answer, B. Rationale: vasopressors, such as norepinephrine, are indicated for septic shock when blood pressure does not improve with adequate fluid resuscitation. Diuretics, A, are contraindicated in hypoperfusion. Increasing maintenance fluids, C, is less effective in this scenario. Corticosteroids, D, may be considered for refractory shock, but are not the immediate next step. Question 47. A 45-year-old male presents with fever, tachycardia, hypotension, and confusion. Blood cultures are positive for gram-negative bacilli. Which assessment finding indicates the patient is progressing to multiple organ dysfunction syndrome, MODS? A. Creatinine 1 mg per deciliter and urine output 50 milliliters per hour. B. Bilirubin 3.5 mg per deciliter and new onset jaundice. C. Platelet count 200,000 with normal coagulation studies. D. Heart rate 90 beats per minute with no arrhythmias. Correct answer, B. Rationale: elevated bilirubin and jaundice indicate liver dysfunction, a hallmark of MODS. Creatinine, A, and platelets, C, are within normal limits. Heart rate, D, is also normal and does not suggest progression to MODS. Question 48. A patient with sepsis develops disseminated intravascular coagulation, DIC. Lab results show prolonged PTINR, elevated D-dimer, and decreased fibrinogen levels. What is the nurse's priority intervention? A. Administer fresh frozen plasma, FFP, as prescribed. B. Start an infusion of heparin to prevent microthrombi formation. C. Monitor vital signs and assess for bleeding. D. Prepare the patient for an emergent splenectomy. Correct answer, A. Rationale: fresh frozen plasma replaces clotting factors and is the priority intervention in a patient with DIC and active bleeding. Heparin, B, may be used for clot prevention but is not prioritized in bleeding. Monitoring, C, is supportive but not therapeutic. Splenectomy, D, is not indicated for DIC. Question 49. A 62-year-old female patient with a history of chemotherapy presents with fever, chills, and hypotension. The nurse observes petechiae on her extremities. Labs reveal WBC 2000, platelets 50,000, and hemoglobin 8. What action should the nurse take first? A. Administer IV antibiotics within 1 hour. B. Initiate a platelet transfusion. C. Isolate the patient to prevent infection. D. Administer erythropoietin to address anemia. Correct answer, A. Rationale: administering IV antibiotics within 1 hour is critical in treating neutropenic sepsis to prevent rapid deterioration. Platelet transfusion, B, and erythropoietin, D, may be considered later, based on clinical needs. Isolation, C, is important but secondary to antibiotic administration. Question 50. A 48-year-old female patient presents to the ED with fever, confusion, and abdominal pain. CT imaging confirms a perforated bowel, and her WBC is 22,000. What is the most appropriate immediate action? A. Administer IV antibiotics. B. Prepare the patient for emergency surgery. C. Insert a nasogastric tube for decompression. D. Initiate an infusion of vasopressors. Correct answer, A. Rationale: immediate administration of IV antibiotics is critical in managing sepsis caused by a perforated bowel. Surgery, B, is likely necessary but not the first step. NG tube insertion, C, and vasopressors, D, are supportive measures but do not address the source of infection directly.
Hi everyone, this is Nurse Anna from nursestudy.net, and today we're going to be doing pneumonia, 50 questions with answers and rationale.
Question 1. A 72-year-old female patient with a history of COPD is admitted with complaints of a productive cough, shortness of breath, and fever. Chest X-ray confirms right lower lobe consolidation. Her arterial blood gas (ABG) results are as follows: pH 7.32, PaCO2 55 mm of mercury, PaO2 60 mm of mercury, and HCO3 26 milliequivalent per liter. What is the most appropriate nursing intervention? A. Administer oxygen via non-rebreather mask at 10 liters per minute. B. Initiate IV antibiotics immediately. C. Encourage deep breathing exercises and incentive spirometry. D. Prepare for intubation and mechanical ventilation. Correct answer, A. Rationale: the patient is in respiratory acidosis with hypoxemia, as indicated by the ABG results. Oxygen therapy is a priority to address hypoxemia. While antibiotics, B, are essential for treating pneumonia, they are not the immediate intervention for hypoxemia. Incentive spirometry, C, is supportive but not urgent, and intubation, D, is not indicated at this stage. Question 2. A 55-year-old male with type 2 diabetes presents with fever, chills, and pleuritic chest pain. Vital signs are as follows: temperature 39.0 degrees Celsius 102.2 degrees Fahrenheit, blood pressure 88/56 millimeters of mercury, heart rate 110, respirations 28 breaths per minute, and SpO2 85% on room air. What is the priority intervention? A. Administer a 1-liter bolus of normal saline. B. Start broad-spectrum IV antibiotics. C. Initiate oxygen therapy by nasal cannula at 2 liters per minute. D. Perform a sputum culture before administering antibiotics. Correct answer, A. Rationale: the patient is exhibiting signs of septic shock due to pneumonia, evidenced by hypotension and tachycardia. Fluid resuscitation is a priority to maintain perfusion. While antibiotics, B, are critical, they should be administered after initial stabilization. Oxygen at 2 liters per minute, C, is insufficient for severe hypoxemia, and sputum culture, D, can be delayed if it compromises treatment. Question 3. A 60-year-old postoperative patient develops fever, crackles in the left lung base, and a productive cough. His oxygen saturation drops to 88% on 2 liters nasal cannula. Which intervention should the nurse prioritize? A. Increase oxygen flow to 4 liters per minute. B. Notify the healthcare provider for further orders. C. Position the patient in high Fowlers. D. Obtain a chest X-ray. Correct answer, C. Rationale: positioning the patient in high Fowlers improves lung expansion and oxygenation. Increasing oxygen flow, A, is supportive but secondary to addressing position. A chest X-ray, D, and notifying the provider, B, are important but not the immediate priority. Question 4. A patient with pneumonia is receiving IV vancomycin. The nurse notes redness, itching, and flushing on the patient's upper body during the infusion. What is the most appropriate nursing action? A. Stop the infusion immediately and notify the provider. B. Slow the infusion rate and monitor the patient closely. C. Administer an antihistamine and continue the infusion. D. Document the reaction as an expected side effect. Correct answer, A. Rationale: the symptoms described are consistent with red man syndrome, a hypersensitivity reaction related to rapid vancomycin infusion. The infusion must be stopped immediately, and the provider should be notified for further orders, which may include restarting the infusion at a slower rate after symptoms subside or pre-medicating with antihistamines. Continuing the infusion without addressing the reaction, B or C, is inappropriate, and documenting without intervention, D, neglects patient safety. Question 5. A patient with bacterial pneumonia has been prescribed azithromycin. What lab finding would prompt the nurse to withhold the medication and notify the provider? A. Serum potassium of 3.5 milliequivalent per liter. B. ALT of 120. C. White blood cell count of 15,000. D. Hemoglobin of 11. Correct answer, B. Rationale: elevated ALT indicates potential liver impairment, and azithromycin can be hepatotoxic. The provider should be notified. The other values are within expected ranges or consistent with infection. Question 6. A patient admitted with pneumonia becomes increasingly agitated and restless. Arterial blood gas results show pH 7.48, P a CO2 30 mm of mercury, PaO2 65 mm of mercury, HCO3 24 milliequivalent per liter. What is the most appropriate intervention? A. Administer a sedative to calm the patient. B. Increase oxygen delivery to maintain SpO2 greater than 90%. C. Encourage deep breathing to correct hyperventilation. D. Prepare for intubation. Correct answer, B. Rationale: the ABG indicates respiratory alkalosis with hypoxemia. The priority is to address hypoxemia by increasing oxygen delivery. Sedation, A, and preparation for intubation, D, are not indicated at this stage. Question 7. A patient diagnosed with aspiration pneumonia has a nasogastric tube in place. What is the priority nursing action to prevent further complications? A. Ensure the tube is clamped between feedings. B. Monitor for residual volume before administering feedings. C. Elevate the head of the bed to at least 30 degrees. D. Irrigate the tube with 30 milliliters of sterile water every 4 hours. Correct answer, C. Rationale: elevating the head of the bed minimizes the risk of aspiration. While other options are appropriate, they do not directly address the prevention of aspiration pneumonia. Question 8. A patient receiving oxygen therapy for pneumonia complains of a dry mouth and headache. What is the most appropriate nursing action? A. Decrease the oxygen flow rate. B. Increase fluid intake and provide oral care. C. Notify the healthcare provider immediately. D. Discontinue oxygen therapy. Correct answer, B. Rationale: dry mouth and headache can result from oxygen therapy, and supportive care like hydration and oral care is appropriate. Decreasing oxygen, A, or discontinuing therapy, D, is unsafe. Question 9. A patient with pneumonia is at risk for acute respiratory distress syndrome, ARDS. Which finding should alert the nurse to this complication? A. Persistent cough with purulent sputum. B. Sudden onset of severe dyspnea and hypoxemia unresponsive to oxygen therapy. C. Decreased white blood cell count. D. Hyperresonance on lung percussion. Correct answer, B. Rationale: ARDS presents as sudden, severe dyspnea and refractory hypoxemia. Persistent cough, A, and other options do not indicate ARDS. Question 10. A patient with a history of stroke and dysphagia is admitted with pneumonia. Which nursing intervention is most important to prevent aspiration? A. Administer antibiotics as prescribed. B. Provide thickened liquids and monitor swallowing. C. Encourage the patient to drink fluids frequently. D. Perform oral suctioning every 2 hours. Correct answer, B. Rationale: providing thickened liquids and monitoring swallowing reduces the risk of aspiration. Frequent fluids, C, and suctioning, D, are secondary interventions. Question 11. A 45-year-old patient with community-acquired pneumonia develops confusion, agitation, and hypotension. Laboratory findings reveal an elevated lactate level of 4.5 millimoles per liter and white blood cell count of 22,000. What is the most appropriate intervention? A. Administer IV fluids and titrate to maintain a MAP greater than 65 mm of mercury. B. Increase oxygen delivery to maintain SpO2 greater than 94%. C. Obtain blood cultures before administering IV antibiotics. D. Initiate norepinephrine infusion immediately. Correct answer, A. Rationale: the patient is exhibiting signs of sepsis with potential septic shock, requiring fluid resuscitation to improve perfusion. Blood cultures, C, and antibiotics are essential, but should follow fluid resuscitation. Norepinephrine, D, is only indicated if fluid resuscitation fails. Question 12. A patient with pneumonia is receiving ceftriaxone IV. On assessment, the nurse notes swelling and tenderness at the IV site. What is the next best action? A. Discontinue the IV and restart it in a different vein. B. Apply a warm compress to the affected site. C. Notify the healthcare provider. D. Flush the IV with normal saline and continue the infusion. Correct answer, A. Rationale: swelling and tenderness suggest infiltration or phlebitis, requiring the IV to be discontinued and restarted elsewhere. Continuing the infusion, D, could worsen the issue, and notifying the provider, C, is not the first step. Question 13. A patient with hospital-acquired pneumonia has worsening dyspnea and crackles in both lung bases. The nurse notes the following ABG results: pH 7.29, PaCO2 52 mm of mercury, PaO2 58 mm of mercury, HCO3 24 milliequivalent per liter. What is the most appropriate nursing action? A. Administer a bronchodilator as prescribed. B. Increase oxygen delivery to maintain SpO2 greater than 90%. C. Prepare the patient for endotracheal intubation. D. Position the patient in a high Fowler's position. Correct answer, C. Rationale: the ABG indicates acute respiratory failure, respiratory acidosis with hypoxemia. Intubation and mechanical ventilation are necessary to improve oxygenation and remove CO2. Increasing oxygen B, or positioning D, is supportive but insufficient in this case. Question 14. A 78-year-old male patient is admitted with pneumonia and confusion. He has a history of dementia and is pulling at his oxygen tubing. What is the nurse's best intervention? A. Restrain the patient's hands to prevent removal of oxygen. B. Reassess the need for oxygen therapy. C. Administer a prescribed sedative to calm the patient. D. Use a nasal cannula and provide reassurance. Correct answer, D. Rationale: using a nasal cannula provides a less obtrusive method of oxygen delivery, and reassurance can help calm the patient. Restraints A. are a last resort, and reassessing oxygen therapy B. is inappropriate if hypoxemia is present. Question 15. A patient with pneumonia is being treated with IV levofloxacin. The patient reports tendon pain in the Achilles area. What is the most appropriate action by the nurse? A. Notify the healthcare provider immediately. B. Administer acetaminophen for pain relief. C. Encourage ambulation to reduce stiffness. D. Apply a cold compress to the affected area. Correct answer, A. Rationale: tendon pain could indicate tendonitis or rupture, a rare but serious side effect of fluoroquinolones like levofloxacin. The provider must be notified to discontinue the medication. Question 16. A 36-year-old patient with severe pneumonia develops a pleural effusion. The provider performs a thoracentesis to remove fluid. Which assessment finding post-procedure requires immediate action? A. Diminished breath sounds on the affected side. B. Oxygen saturation of 94% on room air. C. Sudden onset of sharp chest pain and dyspnea. D. Blood-tinged fluid in the drainage container. Correct answer, C. Rationale: sharp chest pain and dyspnea may indicate a pneumothorax, a potential complication of thoracentesis. This requires immediate evaluation. Diminished breath sounds, A, are expected initially. Question 17. A patient with pneumonia develops acute kidney injury, AKI, after receiving IV vancomycin. Which lab value is most concerning? A. Blood urea nitrogen, BUN, of 32 mg per deciliter. B. Creatinine level of 2.5 mg per deciliter. C. Potassium level of 4.8 milliequivalent per liter. D. White blood cell count of 14,000. Correct answer, B. Rationale: a creatinine level of 2.5 mg per deciliter indicates significant kidney dysfunction. Vancomycin is nephrotoxic, and the dose may need adjustment or discontinuation. Question 18. A patient with pneumonia is found to have a PaO2 and FiO2 ratio of 150. What complication should the nurse suspect? A. Acute respiratory distress syndrome, ARDS. B. Pulmonary embolism. C. Severe sepsis. D. Pneumothorax. Correct answer, A. Rationale: a PaO2 and FiO2 ratio less than or equal to 200 is diagnostic for ARDS. This finding suggests significant hypoxemia requiring aggressive management. Question 19. A 50-year-old patient with pneumonia is receiving high-flow oxygen therapy. The nurse notices the patient is becoming increasingly lethargic and retaining CO2. What is the best action? A. Increase oxygen flow to maintain SpO2 greater than 95%. B. Notify the provider to consider non-invasive ventilation. C. Decrease oxygen flow to prevent CO2 retention. D. Perform frequent neurological checks. Correct answer, B. Rationale: high oxygen levels in some patients with chronic lung disease can suppress the respiratory drive and lead to CO2 retention. Non-invasive ventilation supports ventilation and oxygenation. Question 20. A 68-year-old patient with pneumonia is receiving IV fluids for dehydration. The nurse notes crackles in the lung bases and jugular vein distension. What is the most appropriate intervention? A. Stop the IV fluids immediately. B. Administer a diuretic as prescribed. C. Notify the provider and prepare for intubation. D. Position the patient flat to improve perfusion. Correct answer, B. Rationale: crackles and jugular vein distension suggest fluid overload. A diuretic can help reduce fluid volume and relieve symptoms. Stopping fluids, A, or preparing for intubation, C, is unnecessary unless respiratory status worsens. Question 21. A 40-year-old patient with pneumonia reports increased shortness of breath and chest discomfort during inspiration. Upon assessment, the nurse notes decreased breath sounds and dullness to percussion over the left lower lung field. What is the most appropriate nursing intervention? A. Encourage the patient to use an incentive spirometer. B. Notify the healthcare provider for potential thoracentesis. C. Increase the oxygen flow rate to maintain SpO2 greater than 92%. D. Position the patient on the affected side. Correct answer, B. Rationale: decreased breath sounds and dullness to percussion suggest a pleural effusion, which may require a thoracentesis for diagnosis and treatment. While oxygen therapy, C, and incentive spirometry, A, are supportive, addressing the underlying cause is the priority. Question 22. A patient with severe pneumonia is prescribed methylprednisolone. The nurse should monitor for which adverse effect associated with this medication. A. Hypoglycemia. B. Decreased white blood cell count. C. Increased risk of infection. D. Bradycardia. Correct answer, C. Rationale: corticosteroids like methylprednisolone suppress the immune response, increasing the risk of infection. Hyperglycemia, not hypoglycemia, is a more likely side effect. A decreased WBC count and bradycardia are not typical concerns with this medication. Question 23. A patient with pneumonia develops new onset atrial fibrillation with a rapid ventricular rate, RVR. What is the nurse's priority action? A. Administer a beta blocker as prescribed. B. Notify the healthcare provider immediately. C. Initiate continuous cardiac monitoring. D. Assess the patient's electrolyte levels. Correct answer, C. Rationale: continuous cardiac monitoring is crucial for detecting arrhythmias and monitoring rate control. While notifying the provider, B, and addressing electrolyte imbalances, D, are important, they are not the immediate priority. Question 24. A 52-year-old patient with pneumonia reports severe fatigue and inability to perform daily activities. What nursing diagnosis is most appropriate? A. Activity intolerance related to impaired oxygenation. B. Impaired gas exchange related to alveolar capillary membrane changes. C. Risk for infection related to immunosuppression. D. Fatigue related to increased metabolic demand. Correct answer, A. Rationale: the patient's report of severe fatigue and inability to perform activities aligns with the nursing diagnosis of activity intolerance. Impaired gas exchange, B, is relevant but not specific to this subjective report. Question 25. A patient with aspiration pneumonia is receiving enteral tube feedings. Which nursing intervention is most important to prevent further complications? A. Administer feedings at room temperature. B. Check for gastric residual volume every 6 hours. C. Maintain the head of the bed elevated at 45 degrees. D. Flush the tube with 30 ml sterile water before feedings. Correct answer, C. Rationale: elevating the head of the bed minimizes the risk of aspiration. While checking residual volume, B, and flushing the tube, D, are important, positioning has the greatest impact on reducing aspiration risk. Question 26. A patient with pneumonia is found to have a new oxygen saturation of 82% on room air, with respiratory rate at 30 breaths per minute. What is the nurse's first action? A. Notify the healthcare provider for intubation. B. Initiate oxygen therapy via non-rebreather mask. C. Place the patient in a supine position to improve perfusion. D. Obtain a repeat arterial blood gas analysis. Correct answer, B. Rationale: severe hypoxemia requires immediate oxygen therapy to stabilize the patient. Intubation, A, may be needed later but is not the first action. A supine position, C, may worsen breathing. Question 27. A patient with pneumonia is prescribed albuterol nebulization every 4 hours. The nurse should monitor for which side effect of this medication. A. Bradycardia. B. Hyperkalemia. C. Tachycardia. D. Hypotension. Correct answer, C. Rationale: albuterol, a beta agonist, can cause tachycardia as a common side effect. Bradycardia, hyperkalemia, and hypotension are not associated with this medication. Question 28. A 63-year-old patient admitted with pneumonia develops hemoptysis and severe pleuritic chest pain. A chest CT shows a large infiltrate in the left lung. What complication should the nurse suspect? A. Pulmonary embolism. B. Lung abscess. C. Acute respiratory distress syndrome, ARDS. D. Pleural effusion. Correct answer, B. Rationale: hemoptysis and a large infiltrate on imaging are indicative of a lung abscess, a complication of severe pneumonia. Pulmonary embolism, A, and ARDS, C, have different clinical presentations. Question 29. A patient with pneumonia is started on IV aminoglycosides. Which lab value should the nurse prioritize monitoring? A. Serum calcium levels. B. Creatinine levels. C. White blood cell count. D. Serum sodium levels. Correct answer, B. Rationale: aminoglycosides are nephrotoxic, so monitoring creatinine levels is essential. Other lab values are not directly impacted by this medication. Question 30. A patient recovering from pneumonia reports persistent night sweats and unintentional weight loss. What condition should the nurse suspect? A. Tuberculosis. B. Recurrent pneumonia. C. Bronchiectasis. D. Chronic obstructive pulmonary disease, COPD. Correct answer, A. Rationale: night sweats and unintentional weight loss are hallmark symptoms of tuberculosis, which can occur as a secondary infection following pneumonia. Other conditions are less likely based on the given symptoms. Question 31. A 58-year-old patient with pneumonia develops worsening dyspnea, cyanosis, and a respiratory rate of 34. Despite being on 60% oxygen via a Venturi mask, the patient's SpO2 remains at 84%. What is the most appropriate next action? A. Initiate high-flow nasal cannula oxygen therapy. B. Prepare for intubation and mechanical ventilation. C. Switch to a non-rebreather mask at 15 liters per minute. D. Administer a sedative to reduce respiratory distress. Correct answer, B. Rationale: the patient is experiencing acute respiratory failure with hypoxemia unresponsive to oxygen therapy. Intubation and mechanical ventilation are required to support oxygenation and ventilation. High-flow oxygen, A, or a non-rebreather mask, C, may not be sufficient in severe cases. Question 32. A patient with pneumonia is prescribed IV vancomycin. The nurse notices a trough level of 25 micrograms per milliliter. What is the best nursing action? A. Administer the next dose as scheduled. B. Hold the next dose and notify the provider. C. Increase the infusion rate to avoid delays. D. Monitor the patient for signs of ototoxicity. Correct answer, B. Rationale: a vancomycin trough level of 25 micrograms per milliliter is above the therapeutic range of 10 to 20 micrograms per milliliter, increasing the risk of toxicity. The next dose should be held, and the provider notified for dose adjustment. Question 33. A patient with pneumonia develops confusion and a sudden drop in blood pressure. The nurse notes cool, clammy skin and a weak, thready pulse. What complication should the nurse suspect? A. Pulmonary embolism. B. Septic shock. C. Pleural effusion. D. Myocardial infarction. Correct answer, B. Rationale: the patient exhibits signs of septic shock, a severe complication of pneumonia characterized by hypotension, confusion, and signs of poor perfusion. Other options do not fully explain the clinical presentation. Question 34. A patient with pneumonia complains of sudden, sharp chest pain that worsens with deep breaths. The nurse notes decreased breath sounds on the right side and SpO2 of 88% on room air. What is the priority action? A. Administer pain medication to alleviate discomfort. B. Notify the healthcare provider for further evaluation. C. Encourage incentive spirometry to improve lung expansion. D. Perform a focused respiratory assessment. Correct answer, B. Rationale: the patient's symptoms suggest a pneumothorax or pleural effusion, both of which require prompt evaluation and intervention. While a focused assessment, D, is helpful, immediate provider notification is critical. Question 35. A patient with pneumonia is prescribed a new antibiotic regimen. What finding would prompt the nurse to withhold the next dose and notify the provider? A. Mild nausea after administration. B. Red, raised rash on the chest and arms. C. Temperature of 37.8 degrees Celsius, 100 degrees Fahrenheit. D. Blood pressure of 110/70 millimeters of mercury. Correct answer, B. Rationale: a red, raised rash may indicate an allergic reaction, which requires immediate provider notification and discontinuation of the medication. The other findings are not indicative of an adverse reaction. Question 36. A patient with pneumonia is receiving IV fluids to treat dehydration. On assessment, the nurse notes increased crackles, abounding pulse, and jugular vein distension. What is the priority nursing intervention? A. Administer prescribed diuretics and monitor urine output. B. Discontinue IV fluids immediately. C. Notify the healthcare provider for further orders. D. Reduce the IV fluid infusion rate. Correct answer, D. Rationale: signs of fluid overload require reducing the infusion rate as a first step. Discontinuing fluids, B, or administering diuretics, A, may be appropriate later, but immediate adjustment of the rate is essential to prevent further complications. Question 37. A patient recovering from pneumonia reports persistent fatigue and reduced exercise tolerance. What teaching should the nurse provide to promote recovery? A. Start regular physical activity to regain strength. B. Schedule frequent rest periods throughout the day. C. Avoid any physical activity for at least 4 weeks. D. Increase caffeine intake to combat fatigue. Correct answer, B. Rationale: rest is essential during recovery from pneumonia, especially when the patient reports fatigue. Gradual activity resumption is encouraged, but overexertion should be avoided. Question 38. A 70-year-old patient is admitted with pneumonia and shows a new onset of atrial fibrillation. Which diagnostic test would be most relevant to determine the underlying cause? A. Chest X-ray. B. Serum electrolyte levels. C. Arterial blood gas analysis. D. Echocardiogram. Correct answer, B. Rationale: electrolyte imbalances, such as hypokalemia or hypomagnesemia, can precipitate arrhythmias. Addressing these imbalances is critical in managing atrial fibrillation. Question 39. A patient with severe pneumonia develops respiratory acidosis with ABG results, pH 7.25, PaCO2 60 mm of mercury, PaO2 55 mm of mercury, HCO3 24 milliequivalent per liter. What is the nurse's priority action? A. Encourage deep breathing and coughing exercises. B. Administer bronchodilator as prescribed. C. Notify the provider to prepare for mechanical ventilation. D. Increase oxygen flow to 10 liter per minute by face mask. Correct answer, C. Rationale: respiratory acidosis with hypoxemia suggests impending respiratory failure, requiring mechanical ventilation. Increasing oxygen, D, or using bronchodilators, B, alone is insufficient in severe cases. Question 40. A patient with pneumonia reports a new onset of frequent diarrhea after starting antibiotics. What condition should the nurse suspect? A. Clostridioides difficile infection. B. Adverse reaction to antibiotics. C. Foodborne illness. D. Dehydration. Correct answer, A. Rationale: new onset diarrhea after antibiotics may indicate a C. difficile infection, a common complication of antibiotic therapy. The provider should be notified for further testing and treatment. Question 41. A 64-year-old patient with pneumonia is receiving high-dose corticosteroid therapy. Which laboratory result would indicate the need for immediate intervention? A. Glucose level of 190 mg per deciliter. B. Potassium level of 2.8 milliequivalent per liter. C. White blood cell count of 12,000. D. Hemoglobin of 13.5 grams per deciliter. Correct answer, B. Rationale: corticosteroids can cause hypokalemia, and a potassium level of 2.8 milliequivalent per liter is critically low and requires prompt correction. Hyperglycemia, A, and a mild increase in WBC count, C, are expected side effects of corticosteroids. Question 42. A patient with pneumonia is receiving IV piperacillin-tazobactam. After 15 minutes of infusion, the patient reports difficulty breathing and itching. What is the nurse's priority action? A. Stop the infusion immediately. B. Administer epinephrine intramuscularly. C. Notify the healthcare provider. D. Apply a cold compress to the infusion site. Correct answer, A. Rationale: the patient is showing signs of a possible anaphylactic reaction. The infusion must be stopped immediately, followed by administering epinephrine, B, as per protocol. Provider notification, C, is secondary after stabilizing the patient. Question 43. A patient with pneumonia develops severe hypoxemia and hypotension despite receiving oxygen therapy. The nurse suspects septic shock. Which set of interventions is the priority? A. Administer vasopressors, draw lactate levels, and monitor hourly urine output. B. Increase oxygen to 100%, administer antibiotics, and collect sputum samples. C. Administer IV fluids, draw blood cultures, and start broad-spectrum antibiotics. D. Obtain an arterial blood gas analysis, administer antipyretics, and notify the provider. Correct answer, C. Rationale: septic shock requires immediate fluid resuscitation, identification of the causative organism, blood cultures, and early antibiotic therapy. While vasopressors, A, may be needed later, fluids and antibiotics are the priority. Question 44. A patient with pneumonia reports persistent, sharp chest pain that worsens with breathing. A pleural rub is auscultated on the lower right lung field. What complication is most likely? A. Pleural effusion. B. Pulmonary embolism. C. Pleuritis. D. Acute respiratory distress syndrome, ARDS. Correct answer, C. Rationale: a pleural rub and sharp, localized pain with breathing indicate pleuritis, inflammation of the pleura, a common complication of pneumonia. Pleural effusion, A, would likely present with decreased breath sounds, not a pleural rub. Question 45. A 70-year-old patient with pneumonia is being discharged on azithromycin. What teaching should the nurse include about this medication? A. Avoid direct sunlight, as this medication may cause photosensitivity. B. Take the medication with food to enhance absorption. C. Complete the entire course of the antibiotic, even if you feel better. D. Avoid taking this medication with dairy products. Correct answer, C. Rationale: patients must complete the full course of antibiotics to ensure complete eradication of the infection. Photosensitivity, A, is not common with azithromycin, and taking it with food, B, is optional, not necessary. Question 46. A patient with pneumonia and chronic kidney disease, CKD, is prescribed levofloxacin. Which nursing action is most important before administering the first dose? A. Assess for a history of penicillin allergy. B. Obtain baseline creatinine levels. C. Monitor for signs of gastrointestinal distress. D. Educate the patient about potential tendon pain. Correct answer, B. Rationale: levofloxacin requires renal dosing adjustments in patients with CKD. Obtaining baseline kidney function ensures appropriate dosing to prevent toxicity. Question 47. A patient recovering from pneumonia reports increasing difficulty breathing and fatigue over the last 24 hours. Auscultation reveals wheezing in both lung fields. What is the priority nursing action? A. Administer a prescribed bronchodilator via nebulizer. B. Notify the healthcare provider for a chest X-ray. C. Encourage incentive spirometry to improve oxygenation. D. Assess oxygen saturation and apply supplemental oxygen. Correct answer, D. Rationale: the priority is to assess and stabilize oxygenation. Administering bronchodilators, A, and notifying the provider, B, may follow after addressing oxygenation. Question 48. A patient with pneumonia reports a sore throat and difficulty swallowing after receiving inhaled corticosteroids. What teaching should the nurse provide? A. Stop taking the inhaler immediately and contact your provider. B. This is a normal side effect and should resolve on its own. C. Rinse your mouth thoroughly with water after each use of the inhaler. D. Take the corticosteroid with food to prevent throat irritation. Correct answer, C. Rationale: rinsing the mouth after using inhaled corticosteroids helps prevent oral thrush, which may cause a sore throat. Stopping the inhaler, A, is unnecessary. Question 49. A patient with pneumonia is found to have a blood pressure of 86/54 mm of mercury, heart rate of 124, and urine output of 15 milliliters over the past 2 hours. What complication is the nurse most concerned about? A. Acute kidney injury. B. Cardiogenic shock. C. Septic shock. D. Pulmonary embolism. Correct answer, C. Rationale: the combination of hypotension, tachycardia, and low urine output is consistent with septic shock, a potential complication of severe pneumonia. Question 50. A 66-year-old patient with pneumonia is receiving IV antibiotics. On the third day, the patient reports persistent diarrhea with mucus. What is the most appropriate nursing intervention? A. Notify the provider and request testing for C. difficile. B. Encourage increased fluid intake to prevent dehydration. C. Discontinue the antibiotic therapy immediately. D. Provide antidiarrheal medication to reduce symptoms. Correct answer, A. Rationale: persistent diarrhea with mucus may indicate C. difficile infection, a complication of antibiotic use. Early diagnosis and treatment are critical. Stopping antibiotics, C, without consultation is inappropriate.
Hi, everyone. This is Nurse Anna from nursestudy.net. We're going to continue our infectious disease series. This is tuberculosis, 50 questions with answers and rationales. Enjoy.
Question 1. A 34-year-old male presents to the emergency department with a persistent cough for 3 weeks, night sweats, and weight loss of 5 kilograms over the past month. His chest X-ray reveals cavitary lesions in the upper lobes, and a sputum sample tests positive for acid-fast bacilli. Which of the following is the most appropriate initial nursing action? A. Administer prescribed isoniazid, rifampin, pyrazinamide, and ethambutol, RIPE. B. Initiate airborne isolation precautions immediately. C. Schedule the patient for a bronchoscopy to confirm the diagnosis. D. Educate the patient on the importance of completing the full course of treatment. Correct answer, B. Rationale: airborne isolation precautions must be initiated immediately to prevent the spread of Mycobacterium tuberculosis, as it is a highly contagious airborne pathogen. While administering RIPE therapy, option A, is necessary, precautions must take priority. A bronchoscopy, option C, may not be required as sputum results confirm TB. Patient education, option D, is important but secondary to isolation. Question 2. A patient is receiving treatment for active tuberculosis with rifampin, isoniazid, pyrazinamide, and ethambutol. The patient complains of blurred vision and difficulty distinguishing colors. What should the nurse do first? A. Document the findings and notify the healthcare provider. B. Reassure the patient that visual changes are temporary. C. Hold the medication regimen until further notice. D. Schedule an immediate ophthalmologic evaluation. Correct answer, A. Rationale: blurred vision and color blindness are potential side effects of ethambutol, requiring prompt evaluation. Documenting and notifying the provider ensures the appropriate adjustments to treatment. Reassurance, option B, is inappropriate without confirmation. Holding medications, option C, without guidance may lead to treatment failure. Scheduling an evaluation, option D, is important but not the immediate action. Question 3. A patient with latent tuberculosis is started on isoniazid therapy. Which lab result indicates a potential complication that the nurse should report to the healthcare provider? A. ALT, 125. B. Creatinine, 0.9 mg per deciliter. C. Hemoglobin, 14.2 grams per deciliter. D. White blood cell count, 9,000. Correct answer, A. Rationale: an elevated ALT, alanine aminotransferase, level suggests hepatotoxicity, a known side effect of isoniazid. Reporting this finding is crucial to prevent severe liver damage. The other lab values, B, C, D, are within normal limits and not directly related to isoniazid toxicity. Question 4. A 52-year-old woman with a history of HIV and poorly controlled diabetes mellitus is diagnosed with active pulmonary tuberculosis. Which factor increases her risk of treatment failure? A. History of alcohol use disorder. B. Concomitant HIV infection. C. Use of metformin for diabetes management. D. Non-adherence to annual chest X-rays. Correct answer, B. Rationale: concomitant HIV infection significantly increases the risk of treatment failure due to immunosuppression and potential drug interactions. Alcohol use, option A, and non-adherence to screenings, option D, are risk factors but less critical. Metformin use, option C, does not directly affect TB treatment. Question 5. A patient diagnosed with multi-drug resistant tuberculosis, MDR-TB, is started on bedaquiline therapy. Which adverse effect should the nurse monitor for closely? A. Tinnitus and hearing loss. B. Prolonged QT interval. C. Peripheral neuropathy. D. Hyperglycemia. Correct answer, B. Rationale: bedaquiline can cause QT prolongation, which can lead to life-threatening arrhythmias. Regular ECG monitoring is required. Options A, C, and D are not common adverse effects of bedaquiline. Question 6. A patient with active tuberculosis reports tingling and numbness in the extremities after 3 months of isoniazid therapy. Which intervention should the nurse anticipate? A. Discontinuation of isoniazid. B. Administration of vitamin B6, pyridoxine. C. Immediate neurological consultation. D. Reduction of isoniazid dosage. Correct answer, B. Rationale: peripheral neuropathy is a side effect of isoniazid due to vitamin B6 deficiency. Supplementation with pyridoxine resolves this issue. Discontinuation, option A, or dose reduction, option D, is unnecessary if supplementation is effective. Neurological consultation, option C, is not typically required. Question 7. A nurse is caring for a patient with latent tuberculosis who is hesitant to start treatment. Which patient statement indicates the need for further education? A. Latent TB can turn into active TB if untreated. B. I only need treatment if I start having symptoms. C. I can still spread TB to others even if I feel fine. D. I will need regular monitoring during treatment. Correct answer, B. Rationale: latent TB requires treatment to prevent progression to active TB, even in the absence of symptoms. Patients with latent TB are not contagious, option C, and monitoring, option D, is necessary during treatment. Option A is correct information. Question 8. A patient with extensively drug-resistant tuberculosis, XDR-TB, is receiving delamanid and linezolid. Which finding requires immediate intervention? A. Platelet count, 75,000. B. Hemoglobin, 13.5. C. AST, 35. D. Potassium, 4.0. Correct answer, A. Rationale: linezolid can cause bone marrow suppression, leading to thrombocytopenia. A platelet count of 75,000 warrants immediate intervention to prevent bleeding complications. The other values, B, C, D, are within normal ranges. Question 9. A 29-year-old pregnant patient is diagnosed with active tuberculosis. What is the best approach to pharmacological management? A. Delay treatment until after delivery. B. Start isoniazid, rifampin, and ethambutol immediately. C. Avoid ethambutol and use pyrazinamide instead. D. Use rifampin monotherapy until the second trimester. Correct answer, B. Rationale: pregnant patients with active TB require immediate treatment with isoniazid, rifampin, and ethambutol to prevent maternal and fetal complications. Delaying treatment, option A, or using monotherapy, option D, is unsafe. Ethambutol is safe during pregnancy. Question 10. A nurse is reviewing discharge instructions with a patient who has completed 6 months of TB treatment. Which statement by the patient indicates a need for follow-up teaching? A. I should avoid alcohol to protect my liver. B. I need to schedule regular follow-up sputum tests. C. I can stop wearing a mask since I'm no longer contagious. D. I may need additional treatment if my symptoms return. Correct answer, C. Rationale: patients who have completed TB treatment are typically no longer contagious. However, wearing a mask may still be necessary in certain environments, such as healthcare settings, to prevent reinfection. The other statements, A, B, D, are correct. Question 11. A nurse is monitoring a 43-year-old patient undergoing directly observed therapy, DOT, for multi-drug resistant tuberculosis, MDR-TB. The patient reports nausea and fatigue. Lab results show elevated liver enzymes and a bilirubin level of 3.2 mg per deciliter. What is the priority action for the nurse? A. Administer an antiemetic as prescribed. B. Hold the prescribed medications and notify the healthcare provider. C. Reassure the patient that side effects are common during TB treatment. D. Encourage the patient to increase fluid intake to improve liver function. Correct answer, B. Rationale: elevated liver enzymes and hyperbilirubinemia indicate possible hepatotoxicity, a known side effect of TB medications. Holding the medications and notifying the provider ensures patient safety. Antiemetics, option A, or reassurance, option C, are inappropriate without addressing hepatotoxicity. Increasing fluids, option D, will not address the underlying issue. Question 12. A patient with active tuberculosis is prescribed rifampin. During a follow-up visit, the patient complains of orange discoloration of urine and contact lenses. What should the nurse include in the patient education? A. This is an expected side effect and not harmful. B. You should stop taking rifampin immediately. C. This could indicate kidney damage and requires testing. D. Switch to glasses to prevent permanent staining of your lenses. Correct answer, A. Rationale: rifampin commonly causes orange discoloration of body fluids, including urine and tears. This is harmless and does not require discontinuation. Option B is incorrect, as stopping the medication could lead to treatment failure. Kidney damage, option C, is not indicated by this symptom. Switching to glasses, option D, may be practical, but is not the primary educational point. Question 13. A patient with active pulmonary tuberculosis is prescribed RIPE therapy. 2 weeks into treatment, the patient develops joint pain and elevated uric acid levels. Which medication is most likely responsible for this condition? A. Rifampin. B. Isoniazid. C. Pyrazinamide. D. Ethambutol. Correct answer, C. Rationale: pyrazinamide can cause hyperuricemia and joint pain, gout-like symptoms, as a side effect. Rifampin, option A, isoniazid, option B, and ethambutol, option D, are less commonly associated with this adverse effect. Question 14. A 50-year-old patient with active tuberculosis presents with a new complaint of difficulty hearing. The nurse reviews the patient's medication regimen and suspects which drug is the cause. A. Rifampin. B. Ethambutol. C. Streptomycin. D. Isoniazid. Correct answer, C. Rationale: streptomycin, an aminoglycoside used in some TB regimens, is associated with ototoxicity, leading to hearing loss. Rifampin, option A, ethambutol, option B, and isoniazid, option D, do not typically cause hearing-related issues. Question 15. A patient on treatment for tuberculosis reports persistent nausea and tingling in their hands and feet. Which lab test should the nurse anticipate being ordered to identify the cause? A. Complete blood count, CBC. B. Serum potassium. C. Liver function tests. D. Vitamin B6, pyridoxine, level. Correct answer, D. Rationale: tingling in the hands and feet is a sign of peripheral neuropathy, often due to a vitamin B6 deficiency caused by isoniazid. Testing vitamin B6 levels helps confirm the diagnosis. Options A, B, and C are not relevant for identifying the cause of neuropathy in this case. Question 16. A patient with latent tuberculosis begins treatment with isoniazid. The nurse includes which dietary instruction in the teaching plan to prevent potential side effects? A. Avoid foods high in tyramine, such as aged cheeses and cured meats. B. Increase your intake of calcium-rich foods. C. Limit caffeine consumption to prevent gastrointestinal irritation. D. Avoid foods high in potassium, such as bananas and oranges. Correct answer, A. Rationale: isoniazid can interact with tyramine-rich foods, potentially causing hypertensive reactions. Options B, C, and D are not directly related to isoniazid therapy. Question 17. A 62-year-old homeless patient is admitted with severe weight loss, a chronic cough, and hemoptysis. The patient's Mantoux tuberculin skin test is 15 mm. What is the most appropriate next step for the nurse? A. Collect a sputum sample for acid-fast bacilli, AFB, testing. B. Administer the Bacille Calmette-Guerin, BCG, vaccine. C. Repeat the Mantoux test in 48 hours for confirmation. D. Start prophylactic isoniazid therapy. Correct answer, A. Rationale: a sputum sample for AFB testing confirms the diagnosis of active TB. Administering the BCG vaccine, option B, is not appropriate in active cases. Repeating the MAN2 test, option C, is unnecessary as a 15 mm in duration is positive. Prophylactic therapy, option D, is only for latent TB. Question 18. A nurse is reviewing infection control measures with a patient who has active tuberculosis. Which statement by the patient indicates a need for further teaching? A. I should wear a mask when I'm around others in public. B. I need to isolate myself at home until my doctor says otherwise. C. I can stop using precautions after 2 weeks of starting treatment. D. Family members should get tested for tuberculosis as a precaution. Correct answer, C. Rationale: precautions should continue until the patient has negative sputum cultures, which may take several weeks or months. Stopping precautions after 2 weeks, option C, is incorrect. The other statements, A, B, D, reflect appropriate infection control practices. Question 19. A patient with active tuberculosis is non-adherent to the prescribed medication regimen. What is the most effective nursing intervention to promote adherence? A. Educate the patient about the risks of treatment failure. B. Arrange for directly observed therapy, DOT. C. Simplify the medication regimen to a single drug. D. Schedule weekly follow-up appointments. Correct answer, B. Rationale: directly observed therapy, DOT, ensures the patient takes medications under supervision, improving adherence and reducing the risk of treatment failure. Education, option A, and follow-ups, option D, are supportive but less effective. Simplifying the regimen, option C, is not recommended in TB treatment. Question 20. A nurse is caring for a 68-year-old patient with a history of TB who presents with new symptoms of night sweats and hemoptysis. Which diagnostic test is most important to confirm a reactivation of tuberculosis? A. Chest X-ray. B. Sputum culture for acid-fast bacilli, AFB. C. Interferon gamma release assay, IGRA. D. Tuberculin skin test, TST. Correct answer, B. Rationale: sputum culture for AFB is the gold standard for confirming active TB. Chest X-rays, option A, and IGRA, option C, can support the diagnosis, but do not confirm it. A TST, option D, cannot distinguish between latent and active TB. Question 21. A patient with active tuberculosis has been on RIPE therapy for 2 months. The nurse notes that the patient's liver enzymes remain elevated, and the patient reports ongoing abdominal pain and fatigue. What is the most likely cause of these findings? A. Adverse effects of rifampin and isoniazid. B. Development of a drug-resistant strain of tuberculosis. C. Poor adherence to the prescribed treatment regimen. D. Malabsorption of TB medications due to gastrointestinal issues. Correct answer, A. Rationale: rifampin and isoniazid are hepatotoxic and can cause elevated liver enzymes, abdominal pain, and fatigue. While drug resistance, option B, and non-adherence, option C, are concerns, they do not explain these specific symptoms. Malabsorption, option D, is less likely unless other GI issues are identified. Question 22. A nurse is teaching a group of nursing students about the differences between latent and active tuberculosis. Which statement made by a student indicates a need for clarification? A. Patients with latent TB are not contagious. B. A positive sputum culture confirms latent TB. C. Latent TB can progress to active TB if untreated. D. Latent TB requires treatment to prevent reactivation. Correct answer, B. Rationale: a positive sputum culture confirms active TB, not latent TB. Latent TB is typically identified through a positive tuberculin skin test, TST, or IGRA without symptoms or positive sputum cultures. The other statements, A, C, D, are accurate. Question 23. A patient recently diagnosed with active tuberculosis is prescribed RIPE therapy. The patient asks the nurse why multiple medications are necessary. What is the best response? A. Taking multiple medications prevents the risk of drug resistance. B. Each drug works on a different type of bacteria in your body. C. This is the standard treatment for all infections, including TB. D. Multiple medications reduce the duration of your treatment. Correct answer, A. Rationale: using multiple drugs in TB treatment reduces the risk of drug resistance and ensures effective eradication of Mycobacterium tuberculosis. Option B is incorrect, because TB is caused by a single organism. Option C is misleading, as this is not standard for all infections. Option D is inaccurate, multiple drugs do not necessarily shorten the treatment duration. Question 24. A patient on TB treatment reports dark-colored urine, jaundice, and fatigue. Which nursing intervention is most appropriate? A. Educate the patient about increasing hydration. B. Withhold medications and notify the healthcare provider. C. Administer anti-nausea medications as prescribed. D. Continue therapy and monitor symptoms closely. Correct answer, B. Rationale: dark urine, jaundice, and fatigue suggest hepatotoxicity, a known adverse effect of TB medications such as isoniazid or rifampin. Medications should be withheld, and the provider notified. Options A and C do not address the underlying issue. Option D delays critical intervention. Question 25. A patient with active tuberculosis asks about the importance of follow-up sputum cultures after starting treatment. What is the most accurate explanation? A. Sputum cultures confirm that you are no longer contagious. B. These tests ensure that you don't develop side effects from treatment. C. The cultures monitor your lung function during treatment. D. These tests help determine the effectiveness of your medications. Correct answer, D. Rationale: follow-up sputum cultures assess the effectiveness of TB medications and ensure the patient is responding to therapy. While cultures can indicate a decrease in contagiousness, option A, this is not their primary purpose. Options B and C are unrelated to sputum culture testing. Question 26. A patient with active tuberculosis is on second-line medications due to drug resistance. Which finding indicates a serious complication of these medications that requires immediate intervention? A. Difficulty hearing and balance issues. B. Mild nausea and occasional vomiting. C. Peripheral neuropathy and numbness. D. Headache and slight dizziness. Correct answer, A. Rationale: second-line TB medications like aminoglycosides, e.g., streptomycin, can cause ototoxicity, leading to hearing loss and balance issues, which require immediate intervention. Mild nausea, option B, and dizziness, option D, are common but less concerning. Peripheral neuropathy, option C, requires monitoring but is not an immediate emergency. Question 27. A nurse is caring for a patient with active tuberculosis who is immunocompromised. Which symptom would prompt the nurse to suspect extrapulmonary tuberculosis? A. Persistent cough and chest pain. B. Night sweats and unintentional weight loss. C. Severe back pain and neurological deficits. D. Hemoptysis and shortness of breath. Correct answer, C. Rationale: extrapulmonary TB can involve the spine, Pott's disease, causing back pain and neurological symptoms. Options A, B, and D are more indicative of pulmonary TB. Question 28. A patient on tuberculosis treatment complains of persistent vision changes, including blurred vision and difficulty identifying colors. Which medication is the most likely cause? A. Rifampin. B. Isoniazid. C. Pyrazinamide. D. Ethambutol. Correct answer, D. Rationale: ethambutol is associated with optic neuritis, leading to vision changes and difficulty distinguishing colors. Rifampin, option A, isoniazid, option B, and pyrazinamide, option C, are not commonly linked to these effects. Question 29. A nurse is providing discharge instructions for a patient with active tuberculosis. Which statement by the patient indicates the need for further teaching? A. I need to take all my medications exactly as prescribed. B. It's okay to stop my medication once my symptoms improve. C. I should avoid crowded places until I'm no longer contagious. D. My family members should be tested for tuberculosis exposure. Correct answer, B. Rationale: stopping medications early can lead to treatment failure and drug resistance. Patients must complete the entire course of therapy even if symptoms improve. The other statements, A, C, D, are correct. Question 30. A nurse is assessing a patient with suspected tuberculosis. Which diagnostic finding would most strongly confirm the diagnosis? A. Positive Mantoux tuberculin skin test with 10 mm in duration. B. Interferon gamma release assay, IGRA, showing TB exposure. C. Sputum smear positive for acid-fast bacilli. D. Chest X-ray showing cavitary lesions. Correct answer, C. Rationale: a sputum smear positive for acid-fast bacilli confirms the presence of active TB. A positive TST, option A, and IGRA, option B, indicate exposure but do not confirm active disease. Cavitary lesions, option D, support the diagnosis but are not definitive without sputum testing. Question 31. A patient with active tuberculosis is concerned about spreading the disease to family members. Which statement by the nurse best addresses the patient's concern? A. You are no longer contagious after 2 weeks of treatment. B. Your family should start taking TB medications as a preventive measure. C. You can minimize the risk by covering your mouth when coughing and wearing a mask. D. As long as your sputum cultures remain positive, your family members are safe. Correct answer, C. Rationale: covering the mouth and wearing a mask helps minimize the transmission of Mycobacterium tuberculosis, especially when the sputum remains positive. Option A is not accurate, as contagiousness depends on sputum conversion. Preventive medication, option B, is only indicated for those with latent TB. Option D is incorrect, as positive sputum cultures indicate active contagiousness. Question 32. A nurse is evaluating a patient receiving rifampin for tuberculosis. Which lab result requires immediate attention? A. Platelet count, 120,000. B. White blood cell count, 10,000. C. ALT, 200. D. Hemoglobin, 13 grams per deciliter. Correct answer, C. Rationale: rifampin can cause hepatotoxicity, as indicated by elevated ALT levels. A platelet count of 120,000, option A, is mildly low but not critical. The WBC count, option B, and hemoglobin level, option D, are within normal limits and do not require immediate attention. Question 33. A patient with HIV and active tuberculosis is started on antiretroviral therapy, ART, along with TB medications. Which complication should the nurse monitor for closely? A. Immune reconstitution inflammatory syndrome, IRIS. B. Drug-induced cytotoxicity. C. Severe hypoglycemia. D. Hypernatremia. Correct answer, A. Rationale: immune reconstitution inflammatory syndrome, IRIS, is a potential complication when ART is initiated in patients with TB, as the immune system's recovery can cause a paradoxical worsening of TB symptoms. Options B, C, and D are not typical complications of combining ART and TB therapy. Question 34. A patient diagnosed with latent tuberculosis is started on a 9-month course of isoniazid. Which finding indicates the need for immediate intervention? A. Loss of appetite and mild nausea. B. Yellowing of the sclera and dark urine. C. Intermittent headaches and dizziness. D. Tingling sensations in the hands and feet. Correct answer, B. Rationale: yellowing of the sclera and dark urine are signs of hepatotoxicity, a serious side effect of isoniazid requiring immediate intervention. Options A, C, and D may occur but are less critical unless they significantly worsen. Question 35. A nurse is preparing to administer medications to a patient with multi-drug resistant tuberculosis, MDR-TB. Which combination of drugs is most appropriate for this condition? A. Isoniazid, rifampin, pyrazinamide, ethambutol. B. Bedaquiline, linezolid, levofloxacin, and cycloserine. C. Rifampin, isoniazid, and ethambutol. D. Streptomycin, pyrazinamide, and rifampin. Correct answer, B. Rationale: MDR-TB requires second-line medications, such as bedaquiline, linezolid, levofloxacin, and cycloserine. First-line drugs, option A, are ineffective against MDR-TB. The combinations in options C and D are inadequate for this condition. Question 36. A patient presents with pleural effusion secondary to tuberculosis. Which intervention should the nurse anticipate? A. Immediate initiation of thrombolytic therapy. B. Thoracentesis, to remove excess fluid. C. Administration of intravenous corticosteroids. D. Placement of a chest tube for continuous drainage. Correct answer, B. Rationale: thoracentesis is performed to remove fluid and relieve symptoms caused by pleural effusion. Thrombolytic therapy, option A, is inappropriate. Corticosteroids, option C, may help in some inflammatory TB complications but are not the first intervention. Chest tube placement, option D, is not typically required unless there is significant drainage or complications. Question 37. A patient being treated for tuberculosis reports flu-like symptoms and a red rash on the body. The nurse suspects drug hypersensitivity. Which drug in the regimen is most likely responsible? A. Rifampin. B. Isoniazid. C. Pyrazinamide. D. Ethambutol. Correct answer, A. Rationale: rifampin can cause hypersensitivity reactions, including flu-like symptoms and rash. Options B, C, and D are less commonly associated with these reactions. Question 38. A patient is undergoing treatment for extensively drug-resistant tuberculosis, XDR-TB, and reports severe gastrointestinal distress. Which second-line medication is most likely causing this symptom? A. Levofloxacin. B. Cycloserine. C. Ethionamide. D. Amikacin. Correct answer, C. Rationale: ethionamide frequently causes gastrointestinal side effects, such as nausea and vomiting. Levofloxacin, option A, cycloserine, option B, and amikacin, option D, are associated with other side effects, but are less likely to cause significant GI distress. Question 39. A nurse is counseling a patient who will begin treatment for latent tuberculosis with isoniazid. Which dietary supplement should the nurse recommend to prevent side effects? A. Vitamin C. B. Folic acid. C. Vitamin B6, pyridoxine. D. Calcium. Correct answer, C. Rationale: vitamin B6, pyridoxine, supplementation prevents peripheral neuropathy, a common side effect of isoniazid therapy. Options A, B, and D are not relevant for preventing isoniazid-related side effects. Question 40. A patient with active tuberculosis has been non-adherent to the prescribed treatment regimen. What is the most appropriate nursing intervention to prevent further non-adherence? A. Educate the patient about the risks of drug resistance. B. Recommend shorter treatment regimens to the healthcare provider. C. Enroll the patient in directly observed therapy, DOT. D. Schedule weekly phone reminders for the patient. Correct answer, C. Rationale: directly observed therapy, DOT, ensures that the patient takes medications under supervision, reducing the likelihood of non-adherence. Education, option A, and reminders, option D, are helpful but less effective than DOT. Adjusting the regimen, option B, without clinical justification is not appropriate. Question 41. A nurse is caring for a patient with active tuberculosis who is prescribed a 4-drug regimen, RIPE therapy. The patient reports persistent nausea and vomiting. What is the nurse's priority intervention? A. Administer anti-nausea medication as prescribed before each dose. B. Notify the healthcare provider to adjust the treatment regimen. C. Encourage the patient to take medications with food to reduce nausea. D. Assess liver function tests for signs of hepatotoxicity. Correct answer, D. Rationale: persistent nausea and vomiting may indicate hepatotoxicity, a known side effect of TB medications. Assessing liver function ensures early detection and management of complications. Administering anti-nausea medication, option A, and advising food intake, option C, address symptoms but not the underlying cause. Adjusting the regimen, option B, should only occur if hepatotoxicity is confirmed. Question 42. A 45-year-old male with a history of active tuberculosis is non-adherent to treatment. He presents to the clinic with worsening symptoms, including hemoptysis and fatigue. What is the most critical nursing action? A. Educate the patient about completing his medication regimen. B. Obtain a sputum culture to assess for drug resistance. C. Initiate airborne precautions and notify the healthcare provider. D. Refer the patient for directly observed therapy, DOT. Correct answer, C. Rationale: worsening symptoms and non-adherence increase the risk of active, contagious TB. Airborne precautions must be implemented immediately to protect others. Sputum culture, option B, is important but secondary. Education, option A, and referral for DOT, option D, are necessary but not the priority. Question 43. A patient with active tuberculosis is prescribed pyrazinamide. During a follow-up visit, the patient reports severe joint pain. Which nursing action is most appropriate? A. Administer an anti-inflammatory medication as prescribed. B. Educate the patient to increase fluid intake to flush out uric acid. C. Notify the healthcare provider about possible hyperuricemia. D. Assess the patient's adherence to the prescribed medication regimen. Correct answer, C. Rationale: severe joint pain in a patient taking pyrazinamide may indicate hyperuricemia, a common side effect. Notifying the provider ensures timely intervention. Administering anti-inflammatory medication, option A, or increasing fluid intake, option B, may help but are not substitutes for medical evaluation. Assessing adherence, option D, is not relevant to this symptom. Question 44. A nurse is caring for a 28-year-old patient with a history of active tuberculosis. The patient has completed 6 months of treatment but continues to test positive on sputum cultures. What is the most likely cause? A. Reinfection with a new strain of Mycobacterium tuberculosis. B. Development of multi-drug resistant tuberculosis, MDR-TB. C. Noncompliance with medication during treatment. D. Incomplete diagnostic testing before initiating treatment. Correct answer, B. Rationale: persistent positive sputum cultures after 6 months of treatment suggest multi-drug resistant tuberculosis. Noncompliance, option C, may contribute but is not the direct cause of drug resistance. Reinfection, option A, and incomplete diagnostics, option D, are less likely. Question 45. A 67-year-old patient with a history of chronic kidney disease is diagnosed with active tuberculosis. Which adjustment to the treatment regimen should the nurse anticipate? A. Excluding ethambutol to prevent optic neuropathy. B. Administering medications at lower doses to prevent toxicity. C. Extending the duration of treatment to improve efficacy. D. Administering medications intravenously instead of orally. Correct answer, B. Rationale: chronic kidney disease requires careful adjustment of TB medication dosages to prevent toxicity, especially for drugs excreted renally, like ethambutol. Excluding ethambutol, option A, is unnecessary unless symptoms develop. Extending treatment, option C, or changing the administration route, option D, is not required based on renal function alone. Question 46. A patient with HIV and active tuberculosis begins a regimen that includes rifampin. What is the nurse's priority assessment during treatment? A. Monitor for signs of hepatotoxicity. B. Assess for interactions with antiretroviral therapy. C. Evaluate for symptoms of peripheral neuropathy. D. Monitor sputum cultures for conversion to negative. Correct answer, B. Rationale: rifampin can interact with antiretroviral therapy, reducing its effectiveness. Assessing for interactions is critical to ensure both TB and HIV are managed effectively. Monitoring for hepatotoxicity, option A, and sputum conversion, option D, is important but secondary. Peripheral neuropathy, option C, is less common with rifampin. Question 47. A patient diagnosed with active tuberculosis reports yellowing of the skin and scara 2 months into treatment with isoniazid and rifampin. Which lab test should the nurse prioritize? A. Complete blood count, CBC. B. Liver function tests, LFTs. C. Serum creatinine. D. Uric acid levels. Correct answer, B. Rationale: yellowing of the skin and scara suggests jaundice, likely due to hepatotoxicity caused by isoniazid and rifampin. Liver function tests, LFTs, are essential to evaluate the extent of liver damage. The other tests, options A, C, D, are not relevant to this symptom. Question 48. A patient receiving directly observed therapy, DOT, for active tuberculosis expresses frustration about the inconvenience of daily visits. What is the nurse's best response? A. I understand, but this ensures you complete your treatment. B. You can stop DOT after 2 weeks if you feel better. C. We'll switch you to a shorter treatment regimen. D. Skipping a few doses won't affect your recovery. Correct answer, A. Rationale: DOT is essential to ensure treatment adherence and prevent drug resistance. The nurse should acknowledge the patient's frustration while emphasizing the importance of adherence. Options B, C, and D undermine the purpose of DOT and are incorrect. Question 49. A nurse is reviewing infection control guidelines with a patient hospitalized for active tuberculosis. Which statement by the patient indicates correct understanding? A. I can stop wearing a mask in the hospital since I'm on treatment. B. Visitors should wear masks when entering my room. C. I don't need to be in isolation because I feel better now. D. I should have regular chest x-rays instead of sputum tests. Correct answer, B. Rationale: visitors must wear masks to prevent transmission of TB. The patient should remain in isolation, option C, and continue wearing a mask if transported. Sputum tests, option D, are more effective than chest x-rays for monitoring infectivity. Question 50. A patient with a history of noncompliance is diagnosed with extensively drug-resistant tuberculosis, XDR-TB. What is the nurse's priority intervention? A. Initiate airborne precautions immediately. B. Refer the patient to a long-term care facility. C. Schedule regular follow-up visits to monitor adherence. D. Begin directly observed therapy, DOT, with second-line drugs. Correct answer, D. Rationale: directly observed therapy, DOT, is critical for ensuring adherence in XDR-TB, which requires second-line drugs. Airborne precautions, option A, are essential but not the priority intervention for noncompliance. Referring to long-term care, option B, and scheduling follow-ups, option C, do not address adherence as effectively as DOT.